On Wednesday, a federal judge in Louisiana struck down vaccine and mask requirements for staff and children in Head Start, a government-run early education program that mainly serves low-income children. In his ruling, Judge Terry Doey wrote, "Although vaccines arguably serve the public interest, the liberty interests of individuals mandated to take the COVID-19 vaccine outweigh any interest generated by the mandatory administration of vaccines."
The Health and Human Services Department dropped the requirement already, but Head Start's policy to keep mandates in place is in stark contrast with the Biden administration's Centers for Disease Control and Prevention, which have actually already stopped recommending general mask wearing. And as I pointed out in my piece for Reason, by continuing to impose the mandates on Head Start participants, the government is creating a two-tiered education system that actually singles out economically disadvantaged children for additional mandates that other people are not having to deal with. So the Liberty Justice Center and the Pelican Institute filed this lawsuit on behalf of 24 states. So we've talked about this situation on the show before. It's one the New York Times pointed out, and it is, I think, pretty appalling to a lot of people, that while the CDC no longer generally requires or recommends, they don't require anything, they just make recommendations, sort of. They no longer were saying that there should be general masking unless you're immunocompromised or you're in an area with extreme spread. Head Start was still they had a vaccine mandate in place for all staff and a mask mandate for the kids if they're indoors and even outdoors. If they can't social distance, they're supposed to wear masks, kids as young as 2. This is not a requirement that's on any other kids more generally. So the government is not saying anyone else has to do this, and even admitted, like when called out on this, they're like, yeah, we'll probably get around to changing this and we're not going to enforce it right now. But that that leaves schools in a very weird, it's technically illegal to not do it, so should we be trying to wrestle masks onto kids' faces, which is really dumb. And again, because Head Start doesn't have, my understanding, it's just a program. So you could literally have schools where you'd have the Head Start kids having to wear masks and the non-Head Start kids, even though they might be in like the classroom next door, not having to mask, which is crazy.
Yeah, so
it's crazy.
And it seems like the government was also thinking it's crazy, which is that they weren't why they weren't going to enforce it. So it seems like everyone was on the same page. The government realized, it wasn't intentionally keeping these people under a mask mandate versus other people. It had to do with the administrative, obstacles to getting things done and how the chips fell in different other areas with respect to mandates because of various other.
So they initiated this lawsuit last November. Mm-hmm. So now, more recently, the government said, okay, yeah, we don't really think this mandate should be in place. So what I'm hoping is they don't appeal this decision. They could appeal this decision to the Fifth Circuit.
Sure.
I'm hoping they just don't, because they've said we don't want to. So please just let it go. Yeah,
it sounds like the government is doing the right thing and never enforced it, didn't really want it. It seems like the courts are all on board and everybody's on the same page. So it seems like a victory story for those people who, really wanted these liberty interests protected. And now that everyone is able to make their own choices, the question becomes, are they going to actually be able to make those choices? Now, I recently discovered, as I tried to order more COVID tests last night, that I missed the deadline, the September 3rd deadline for getting the free COVID tests. Are people who, you pointed out, are economically disadvantaged in these Head Start programs going to be able to afford, $15 tests to do the regular testing that they need to make sure that they are not coming to school and spreading the virus? Teachers who are under the best of circumstances, regularly exposed to viruses from kids, are they going to be able to do regular testing multiple times a week, spend $60 a week on these kinds of kits? Are there going to be HVAC systems actually implemented in schools after all this money was passed out? Are we going to actually see the air quality where our younger and more economically disadvantaged kids are going to school? And what happens if there are these effects from repeated infections? Everyone, is saying now that people are going to get COVID lots of times. Fair enough. If we see growing incidences of long COVID as a consequence, who is going to pay for that? And is this going to be something that reignites a conversation about universal health care and whether or not our society can really persist if we have huge swaths of the population laid low by this particular disease? Well,
on the testing front specifically, something clearly went wrong at some point, and in part because, as we know, the government has bungled the testing side of this pretty badly from the beginning when they kind of centralized the testing process and then had a fault. They went all in on a faulty test that they had to correct, and we've seen a lot of subsequent reporting from watchdog journalists outlets on how it's just been bungled continuously, how other people of their own volition came up with good tests that the CDC was reluctant to sign off on. I don't know what the status is now. The tests we do have, it seems to me, anecdotal, or like from people you talk to who have COVID who test, that it captures your infection, maybe, that they're not like totally reliable. I mean, at least this was the case when I knew a lot of people taking tests probably last Christmas time. And in January, when like everyone I knew in the city was getting it, my wife got it then. It was like,
and the test didn't.
So she took a test. The first one we took, yes, it showed her. But I knew people I worked with, not at the Hill, but at Reason, were saying they were sick and they tested like 6 times. Test the next day they would test, the next day they would test, and it took several times before it showed a
Well, yeah, the home
result.
tests don't capture the disease as quickly as these kind of in-person PCR tests. And that's another thing. Are people going to have financial support and accessibility to those kinds of tests, especially since people don't have general practitioners, they don't have a regular relationship with a doctor? All of these things, we just did a segment with someone who pointed out that 300,000 plus people, studies show, could have been saved from death in the COVID pandemic if we had had a better healthcare infrastructure, if we had had something like Medicare for all. So I really respect everyone who's been pushing to hold the government accountable, to have more consistency in its policies, and to protect the liberty interests of people. Now, for me, the question is there going to be a persistent effort to hold the government responsible to take care of its citizenry, or was this just about calling out, the Biden administration versus actually advocating for the broader interest of the American public?
I would love to live in a world where the testing was very reliable and very ubiquitous. I think that would be, especially versus other interventions, I think it is less intrusive to have people just test. Before you go into school, before you go into anywhere. And I know people watching are going to shout at that, but I would prefer that than everyone having to wear masks all the time, or being required to get vaccines, or being constantly injected. The testing is the less intrusive, especially if it was very reliable and you could catch infections before you were spreading COVID, and you could get the R naught number down.
Yeah.
That would be, there would be, in the era before we had the vaccines and before we knew how well the vaccines were going to do, I really thought that was going to be the only way out of the pandemic, because I thought the vaccine would be as effective as like the flu vaccine, which does not eradicate flu. So I thought testing would be the way out of it. Then we got better than expected news about the vaccines for a window, and now, now they're again, how many times do we have to say they're still doing well on severe disease and death for at-risk populations? For cases, they're not doing much. So
one thing that people have been pointing out online is that industries where talent is not replaceable, like the film industry, where if someone gets sick, the whole production shuts down and millions of dollars are lost, have been testing maniacally and have had very few infections. So it's an interesting model to continue to follow.
But we're saying we're not valuable. We don't test.
Like I said, I tested last night. So some of us
There's going to be no one left to host the show.
Adhering to that model.
We're at the end of the host.
All right. We'll have more Rising for you after this.